Hi ladies! This is going to be an unusual recording, as I was asked by a friend some time ago to make a recording in English. I've decided after a long time of hesitation to do so, and today I am going to introduce you with an English version of my episode called What I Don't Want to Hear as a Patient. My intention is not to edify anyone. I just want to say what I feel. I've spent a lot of time in hospital corridors, in operation tables, and there are some reactions and some behavioral patterns that are common to many medical staff in almost any public institution. By public institution, I mean hospitals, I mean health centers, and I'm hoping that by showing you and sharing with you some of my real situations that happened to me during my time of oncological treatment, I will be able to increase the awareness of how such behaviors and some rigid reactions can be perceived by us patients. Situation number one. I am in one of the big oncological treatment centers waiting for my ultrasound. After 2 hours of wait, I am finally called to the examination place where I'm instructed to take off my shirt. After that, the examination begins. I only hear comments asking me to stay still and to breathe or not to breathe. And then during the examination, I try to ask some questions about my case. But none of the questions is heard. I am simply ignored. I feel, and I know that I'm there physically, but I feel as if I was invisible. Situation number two. I go for a regular checkup and meet with 2 doctors. After a regular examination, one of the doctors needs to urgently leave the meeting, so I'm left with the other, younger staff representative. He doesn't even bother to ask any question. He just takes his phone out of his pocket and starts to browse the internet. So here we are, sitting in silence for at least 10 minutes.
Onkowitka Litka.
The next scenario that I want to talk about involves being naked in many doctors' offices. During my oncological treatment, I had numerous cases where I would be just half naked, undergoing some examination. There would be times, especially during case conferences, where I would be in the same room with at least two doctors, and then there would be 4, 5 additional people that would represent the administrative staff. I am not sure why I didn't disagree with that, why I allowed them to just simply follow the rules that were present at the time. But looking at it from a different perspective now, I believe that when one undergoes such difficult moments in one's life, one doesn't really necessarily focus on what's most comfortable to oneself. When I look at myself, I know that at that time I made priorities in my head, and my priority was not to necessarily stay comfortable, but to stay alive. And I know now that those two priorities can be simply connected, and that you can stay alive and at the same time feel comfortable during your examination. But at that moment, that wasn't so straightforward to me. So I would advise you girls that whenever you have an examination and you don't feel comfortable with that, there are too many people in the same room, please ask the staff to leave the meeting. Ask only for the doctors to be present. There are some ways in which you can help yourself. And if we don't start talking about it, nothing will change.
Nie bądź sama, bądź dobrze poinformowana.
And the next situation, which is very common, and I would say it's my favorite one. This is something very particular to Polish medical system. Every time you would go to a doctor's appointment and doctor's visit, you would, especially in the older generation of medical staff, they have a certain way of addressing some of the questions to you. So they would ask them in a third person. So instead of saying, did you register? They would say, did she register? Did he register? And they would still at the same time ask and look at you. And they would also say, let her sit, let her undress the blouse, let her wait. And you know, I don't really understand where this came from. But wouldn't it be easier just to say directly, would you mind to undress yourself? Would you mind to register? Did you register? It is the same number of words and yet much more modern way of communication. And finally, the rest situation regards any rude comments that happen to me almost always. Of course, I'm not saying that there aren't any medical representatives that are sweet and really devoted to what they're doing. But even during your hospital stay, if you're satisfied with what happened with the surgery, there might always be one or two person that will just destroy all your satisfaction because they will just add any unnecessary comment. They will say something that is really unnecessary. And I must say that the worst rude comments that I've had was in the ambulatory ward of chemotherapy. And I experienced there some of the comments that shouldn't be said at all, that regarded my the way I felt, mostly the way I felt, that I was too cold, and one of the nurses would joke that I should sit in a different room, or when I said that I feel as if I vomit in a second, she just laughed and asked very impolitely if I wanted to have any pot or something that I would throw up. No deeper feelings. And I don't agree with that, of course. And I just wanted to say that taking chemo is a very difficult time, and patients usually are terrified. They have no idea what's going to happen to them, and taking advantage of that is simply cruel. And I would expect that the medical staff, especially the nurses that work in such chemo wards, they are used to that. It's nothing unusual that the patients, because of their level of stress, might be sometimes very difficult to deal with. But that's your job, and like we cannot do anything about it. And sometimes instead of being rude, explaining in more details what's going to happen, asking or explaining something with patience might be much more useful than trying to be ignorant or simply impolite.
Onkofitka, Litka.
Dear medical staff representatives, thank you for your time, your patience, your engagement, your support, your knowledge. I've encountered many devoted physicians and nurses along the way, and I'm very grateful for that. For those of you who understand what good communication is, thank you. This is greatly appreciated by us patients. And for those of you who still feel that have some homework to do, I would give a few pieces of advice. First of all, don't judge us. You don't know us, so in order to understand what's going on in our head, it is always useful to understand the patient's perspective. So once you understand what our motives are, what our motivation is, what we want to achieve in a final, as a final outcome, you will be able to understand why we behave in a certain way or ask particular questions. Secondly, do not position yourself as experts. Of course, most of the times you will be the expert, and patients will be very grateful for your good advice, your knowledge. But sometimes, if you don't know the answer, just say it. I honestly would appreciate much more a physician that doesn't know the answer than a physician that tries to make up some story based on a question that I've just asked. So use your knowledge in a smart way, and then don't try to know everything. This is simply humanly impossible. If you don't want to do something that a patient constantly asks for, explain the situation to a patient. Perhaps he or she doesn't understand why you don't want to do something. That happened to me many times when I asked my oncologist to prepare for me a certain kind of document that was necessary for some public services. I didn't know that this is something that is very bureaucratic and doctors do not simply have time to do so. Please explain why you don't want to do so. Perhaps you can ask the patient to fill in the form by themselves, and then you will just need to sign it. Or perhaps you can ask a patient to go to another doctor to do it for himself or herself. Please respect your patients and explain anything that needs to be said with patience and with respect. I know that this might be difficult, especially when you run out of time, but this is crucial to us as patients. And one more thing, it might not hurt if you smile from time to time. I am sure that this will not hurt anyone's feeling, and the overall impression of the visit that we've just had will be much better. Thank you all who have come along my way during my oncological treatment, the ones who gave me their support, their time, their knowledge. That was very much appreciated. And to you girls, I hope that this movie was useful to you. Feel free to put any comments below the episode. If there's anything you would like to share, please do so. Thank you once again, have a good day, and see you next time.